Hi, good evening, and welcome to another presentation from the How You Diet. This is Paul Malkmus, and want to welcome you here this beautiful evening in September. And we have a presentation this evening from Dr. Siobhan Jackson McHale on the better way to stomach health. Enjoy eating again. And this is an important topic because so many people are dealing with stomach issues, and so many people refer to the stomach as a second brain. And we're really happy to have Dr. Siobhan with us this evening, as she'll be sharing with us how we can really enjoy better health in our stomach and gastrointestinal areas. So we're excited to get there. But before we do, just want to welcome you and thank you for joining us. It's trust that you've had a wonderful summer, and it's amazing how quickly this year has passed us. It's already the middle of September. But before we get started, I would like to open us up in a word of prayer and just ask the Lord to bless our evening. And dear Lord, we just thank you for this day, and we thank you for the opportunity to share this message. We pray that you'll bless Dr. Siobhan this evening, that you'll give her the words to say and give us the ears to hear, and that we'll be able to really help people improve their health in ways that they haven't seen before. And we pray that you'll just bless our evening, that we honor you through it. In Jesus' name we pray. Amen. Well, Dr. Siobhan is a licensed naturopathic doctor with a Bachelor of Science degree in biomedical engineering. As a science officer, Dr. Siobhan leads the conceptualization, design, and oversight of clinical studies and provides integral direction in the development of product education that supports the products. Before entering the business sector, Dr. Siobhan taught health science and wellness-related coursework for nearly 6 years as a university professor and worked as an industry consultant. She still maintains a small wellness practice where she advocates a select number of clients or advises rather, a small number of clients on natural approaches to common health concerns. Dr. Siobhan, thank you so much for joining us this evening.
Thank you so much for having me, Paul, and thank you to the HA Diet family. So I'm so happy to be here with you guys today and to be talking about stomach health. And thank you for the introduction. And if we are okay to get started, I'm ready to talk to you guys a little bit about how we can enjoy eating again. So
I believe we're ready.
We're ready? Okay, great. So enjoy eating again, right? Eating should be enjoyable. Of course, we want to be nourished by the food that we eat. That's the number one goal. But we should enjoy it. We should take pleasure in it. It should not be something that causes us distress and causes us concern and frustration, or, makes us just kind of see eating as a duty or a job. And so I'm hoping to be able to provide a little context to why so many people suffer from stomach and upper gastrointestinal distress, to give a little bit of insight into what we can do about it, and, to offer some hope. So stomach and upper GI distress. A lot of times we talk about this idea of gut health, right? Gut health is very, very common phrase, or, even gut distress or gut dysfunction. We use this word gut very casually. And oftentimes that association with the word gut really has people talking about the lower portion of the GI tract, like your end of your small colon to the remaining of your large colon, rectum, and how we remove food from our body. So the idea of gut health sometimes removes from it the stomach, okay? We only talk about stomach ache when we think we've eaten a bad meal, or maybe we've, had some kind of food poisoning. Maybe we talk about it if we have, what we call like a food virus, or, a stomach virus or something like that. But stomach and upper GI distress is actually very, very common as an ongoing repetitive type of condition. It actually affects around 25% of the global population. It doesn't really have a connection directly with any known clinical cause, meaning a disease that's underlining it. So we call it functional. And one of the most popular, or you can say reference names for this type of distress is functional dyspepsia, right? So that's a little bit of a scary word, but so we're going to talk about it just as stomach and upper GI distress. Upper GI distress, including the stomach, has been literally quoted, I've taken this from the literature, as causing a poor quality of life. This is something, as it affects maybe a quarter of the global population, it's something that's affecting people through multiple meals per day. We eat, at least most people eat once a day. So let's say once a day, multiple times per week. And so you can just imagine that if you're constantly dealing with some kind of stomach or GI distress on a frequent basis, this is going to impact your quality of life. It's also been quoted as being clinically challenging to treat. And so what that means is we haven't been able to pinpoint a specific mechanism that is causing this kind of distress in every kind of person that we can target with a specific drug. A lot of the medications that can be utilized for this type of stomach distress are actually considered off-label. So like, we'll talk about this in some slides that are ahead of us, but some of these are antidepressants. Some of them are antibiotics. They're not specifically focused on the stomach. So it's considered a clinically challenging condition to treat. Not only that, there's a lot of money spent in trying to understand or uncover why people have this stomach and upper GI distress. In fact, more people normalize it than they do sort of like get benefit or get treatment for it, if you will. It almost becomes part of what you deal with. And this has to do with the clinically challenging aspect of it. It's hard to pinpoint even with diagnostics, meaning different types of imaging, different types of blood work, and multiple visits to the doctors. It makes it very difficult to pinpoint. And this leads to a burden economically of a lot of money, okay? The most recent statistic that I could find was about 10 years old, but still you can imagine now that this number has to be even more. Some of the associated risk factors include getting older, just plain old getting older, female gender, especially as they move into menopause, having H. pylori infection. So H. pylori is a very common food microbe that can move into our food, you know, from raw vegetables or raw fruits. And if you don't have proper, say, stomach acid or what have you to kill off these bugs, they can wreak havoc in the digestive tract. I have a little asterisk right there because that is a direct cause sometimes to stomach distress. They can identify this infection, then they can usually treat it, and sometimes people will recover from their distress, but not always. The chronic use of aspirin and NSAIDs, so these are like your ibuprofen, chronic use of these will cause the stomach lining to be disturbed. It doesn't allow the stomach lining to replace itself and be protected. That can lead to distress. Diabetes and stress, this is a very interesting one, can put you at risk for stomach dysfunction. We'll talk about why, but it's a very, very interesting thing that diabetes and stress in different forms does to the stomach. It actually inhibits one of the cells that help us move food down the digestive tract. Having hypersensitivity to the gut, why does that happen? That's really connected to our nervous system. So when people are stressed, chronically stressed, anxious, things of that sort can also lead to this stomach and upper GI distress. And then the list sort of goes on in that regard. So just to talk a little bit more about the social and economic burden, I found some very nice numbers here that really are shocking. In order to somehow come to a diagnosis or an assessment of this kind of stomach and upper GI distress that so many people live with, the research shows that it takes a minimum of 3 visits to your primary care physician. And that could be per year because it can come, it can go, it can come under certain stressful conditions of life. As things maybe calm down, then maybe it kind of goes away, but then it resurfaces, months later. So a minimum of 3 visits to your primary care doctor per year. They've noted that per person per year, in order to try to uncover why this stomach distress and stomach pain exists, it costs on average $790 per person per year. And this is including what is done to get us information from our blood work, to do an endoscopy when they go down your throat with a scope and try to look around and see what's going on in the esophagus and in the stomach, ultrasounds, CAT scans. So, you can see the distribution here, but in total, we're talking about $800 per person per year. And then medical visits and treatments. So these are things that you spend out of pocket for OTC, over-the-counter medication. So your antacids, your acid-reducing medication, various things, your Gas-X, your things of that nature that you might go grab just based off of, what you've seen on the commercial or what you read on the back of the label that you think might be able to help you with this stomach distress. Another $300 in co-payments to see those doctors, to see those specialists, and even the pursuit of alternative treatments that may or may not work. In total, we're talking about something on the order of around $1,600 to $1,800 per person. And we said this is affecting around 25% of the global population. In the US, the number is around 20%. So you can, again, just do the math and imagine we're in the billions of what the burden is for stomach distress. In addition to that, you can see that productivity. So there's a loss of an average of 1.4 hours of work or just being plain old productive in life per week due to this type of stomach and upper GI distress. The issue here is that people normalize it, right? You got to move on with life. You got to eat. So you just sort of live with it. But what if there was a better way to stomach health? So I have a little, oops, let me go back. I'm going to have you concentrate here. Sorry guys, this is not quite showing us exactly what's going on, but we'll kind of follow it one square at a time. So you can see you swallow a bolus of food and you can see that there's a squeezing as it moves down the esophagus. You guys are following me in this top box. It squeezes through the top part of the stomach and you're gonna see that food go into the stomach, which you're seeing right here in the second one. It gets into the stomach juices and acid. The food should move out of the bottom portion of the stomach and it should make its way into the intestines, which you can see in this bottom picture. It's traveling through the small intestines, okay? It will make its way around the large intestines and ultimately come out of the body. So I just wanted to show you this in sort of an animated way. And then I have a still shot here, which I'm gonna have you guys follow me based off of numbers. There's lots of stuff going on here, but I wanna have you follow me with these numbers. I'm gonna use my pen, my laser pointer. We're gonna follow each other. We're gonna start at step 1. So we talked about, or we just saw in that animation, you take a bite of your sandwich, you chew it really well, hopefully around 30 times. You swallow it, it moves down the esophagus. As it's moving down the esophagus, which is above where my pen is, you're going to be having a squeezing motion, and sort of a pushing motion. So it's squeezing around the tube and it's also causing the tube to go downwards, okay? So that food, that swallow of food that you just took will move all the way down to the esophagus into the area of the stomach, okay? So the stomach is where you would be producing your gastric juices, your acid, your enzymes to start protein digestion. All of that will happen in the stomach, okay? So we're following from step 1 to step 2. You got food in the lower stomach. As that food accumulates in the stomach, what should be happening is there's a little tightening of muscle here at the end of the stomach, and there's a tightening of muscle here at the beginning of the stomach. The stomach is going to move in a 3-dimensional way, okay? It's going to be squeezing, it's going to be churning, it's going to be moving in a downward fashion. So 3-dimensional way. And those gateways, the one at the top by the esophagus here and the one at the bottom of the stomach near the small intestine, should be closing off the stomach from moving backwards and moving forwards until the stomach has fully digested its components, or what's inside of it. It totally depends on what we're eating, what our meal is composed of. If you have fat in your meal, whether it's plant-based fat or animal fat, fat causes the food to stay in the stomach longer. If you have some simple carbohydrates or even plant-based, not plant-based, but simple carbohydrates or even slightly more complex carbohydrates, they'll move out of the stomach a little faster. And protein is somewhere in the middle, okay? So the stomach will churn until little bits of that digested food or partially digested food moves out of the stomach, okay? So now we're moving on to step 3. I mentioned in step 2, you got food in the lower stomach. The food in the lower stomach, depending on what it is composed of, as I said, is it more fats in there? Are there more proteins in there? Are there more carbohydrates in there? It will release certain hormones, one of which is called gastrin, and gastrin will tell the stomach to continue to move, okay? Motility just means movement. We want the stomach to continue to churn, to break this food up, to get it completely surrounded by acid and other enzymes so that we can break it down, all right? So this is sort of like a cycle, all right? Until the stomach, is aware or notices that the food is mostly broken down, it will not signal to move into the small intestine. So we go from step 1 to step 2 to step 3, now we're in step 4. In step 4, that food will move into the duodenum. The duodenum is the first part of the small intestine. It should move there slowly, okay, in spurts, because acid is only able to be present in the stomach without causing damage. The stomach cells, in addition to producing this hormone called gastrin, and in addition to producing acid and some enzymes, it also produces mucus. And mucus protects the stomach lining from the acid that has to be there to digest your food. The esophagus does not have that protection. The duodenum does not have that protection, okay? The first part of the small intestine. So this food needs to move out in a coordinated fashion. It needs to move out in a slow enough fashion, not too slow, but slow enough fashion, so that the small intestine can be signaled that there is acid food there. And you can see that the small intestine will release another kind of hormone. This hormone is called secretin. You don't really have to know the name. But what that hormone is telling us to do is to do a few things. To tell the stomach to slow down a little bit, okay? We only want you to put a small amount at a time, because the duodenum has to neutralize that acid with something called bicarbonate. Bicarbonate is just like you putting baking soda into the stomach, okay? Into the small intestine. We need to neutralize the acid by having the pancreas dump a little bit of baking soda, if you will, into the small intestine. So there's a lot going on here, all right? But if we just recap, 1, the food comes down the esophagus. There's a movement that's downward and squeezing at the same time. It gets into the stomach. Most of it kind of falls to the bottom of the stomach. There are sensors in the stomach that will notice what type of food is there, carbs, fats, proteins. It will release a certain amount of hormone to tell the stomach to continue churning and to increase the production of acid. That's also enzymes as well. It does that so that we can digest the food properly. Then that food moves into the small intestine, step number 4. It needs to move there slowly in spurts so that the small intestine can recognize that there's acid there, so that it can slow the stomach movement and so that it can neutralize the acid. The food will continue down and you will see that there's more hormones released, enzymes released, bile released, all of which will help us finalize the digestion of food so we can start to absorb it. So all of this is considered stomach and upper GI. Upper GI goes until you get to pretty much the first section of the small intestine called the duodenum, all right? It includes the stomach and it includes the lower portion of the esophagus. So hopefully that wasn't too confusing. All right, so let's talk about some of the symptoms of upper GI distress. Stomach pain and or burning. Okay, so it can be the classic stomach ache where you got a little bit of nausea going on. It can be this kind of doubling over pain type of stomach ache. It can be a dull, just sensing that food is in your stomach. And it can be a burning in the stomach that can kind of rise up even into the esophagus and what we know of as heartburn. All right, that stomach pain is usually above the navel. So that's how you can sort of differentiate it from lower gut health or lower gut pain. It's above the navel, above the belly button. Fullness before completing a normal size meal. So you put your plate in front of you, it's not overloaded, but you get, a quarter to a halfway into the plate and you realize you're really full. Sometimes that can happen because of gas. Sometimes that can happen because the food does not properly move through the stomach as it should in a timely fashion and move down into the lower part of the GI tract. So there's a slowness that possibly has some food backed up from a previous meal that you ate. Bloating, so again, above the navel is very characteristic, okay? So you get a fullness above the navel, not bloating that kind of happens in the lower abdomen or over the pelvis region, but above the belly button. Heartburn and indigestion, unexplained recurrent nausea, especially associated with eating, and excessive burping or belching. So this type of upper GI distress / stomach distress can happen. You can have all of these symptoms. Most people do not have all. Most people have a few. They may have stomach pain, fullness and bloating. They may have heartburn and bloating. They may have nausea and heartburn. It can kind of happen in any kind of combination. It doesn't have to be all. So I have a question for you guys, and I want to see what what you guys are thinking of the symptoms that I just described. Do you or someone you know regularly experience any of them? So you can comment in the chat. A, for stomach pain or burning. B, for fullness before completing a normal size meal. C, for bloating above the navel. D, for heartburn and indigestion. E, for excessive burping. F, for none of the above. And G, for all of the above. I see A coming in, stomach pain. Okay, so we're getting a lot of stomach pain. You're getting some stomach pain. All right, so there are quite a number of people who experience these symptoms. So I welcome you guys to put some comments in the chat. And we may be able to come back to some of these questions as we go along. All right, so let's keep moving. Sorry, it looks like we were getting stuck for a second. All right, so why is this happening? Why is this happening? Some studies have discussed this idea of a dysfunction in the way that your nervous system and your muscular, the muscular aspect of your stomach and your upper GI tract are working. So what this does is it delays the emptying of stomach contents. Remember I said that food needs to come down the esophagus, sort of land in the lower part of the stomach, and then move through the small intestine, but in a very slow way. If it happens too slow, we have a problem because that food sort of sinks and kind of hangs out in the lower portion. And you can see that it's a little bit almost like sagging, if you will. All right, so a delayed emptying of stomach contents are one of the reasons why people tend to have the symptoms associated with gastric distress. The impaired ability of the stomach cavity to relax. So after you have eaten a meal and that food has gone through the stomach and moved down the intestinal tract, the stomach needs to go back to a relaxed position. But because the stomach, just like everything else in the body, is, the nervous system is speaking to the stomach. If you are hyper, if you are nervous, if you have a lot of tension, the stomach is less likely to relax. Okay, the stomach is actually, and the whole digestive tract is triggered by our rest and digest part of our nervous system. It's the relaxed side of our nervous system. We should be eating and be relaxed. All right. We should not be eating and, driving, for instance, or eating under stress or rushing, all of which does not allow our stomach to relax so that it can take on the proper amount of food. This third bullet here, reduced ability to accommodate a meal portion. So you can see here that the stomach should actually be quite, it should be sort of bulged out at the top, okay? That top part of the stomach is actually called the fundus. It's the rounded part. And people who have this dysfunction of the nervous system in association with the stomach do not accommodate food well. So once they put food in their stomach, the stomach is not expanding enough. Therefore, the stomach cannot take on the amount of food that it normally would. Being oversensitive to the stretching with incoming food. So this can be for people who do a lot of binge eating. This can be for people who maybe eat once a day and sort of overdo their portions. It's a little bit of stress to the stomach, all right, because we're putting it under a lot more capacity, and then it becomes oversensitive to stretching. The last bullet here is very interesting, and this ties back to what I mentioned about stress and diabetes. There are these cells that line the stomach. They actually line the entire intestinal tract, but this is sort of a zoomed in aspect of it. And there are these little blue cells that you see here. They're part of the nervous system, okay? So the digestive tract has its own separate nervous system, and Paul kind of hinted to that a little bit earlier. It has its own part of the nervous system. It's called the myenteric plexus. It's part of the nervous system that is exclusive to the GI tract. And within there, you have these cells. They're like pacemaker cells. That's what they're called, stomach pacemaker cells. So the same way you have a pacemaker, some people have a pacemaker in their heart that replaces, that beating that's almost involuntary. It allows us to spark the heartbeat. This is what sparks the coordinated movement of the digestive tract. It's what allows the digestive tract to squeeze and propel things downward, okay? When you have diabetes or under oxidative stress, so diabetes has a lot of free radicals that are produced. Other conditions that will cause a lot of free radicals to be produced have been associated with damaging that part of the nervous system. When they're called ICC cells, interstitial cells of Cajal, when they are damaged, then you disrupt the normal motility or movement of the stomach, and you lead to the symptoms that we discussed. I have another question here for you guys. What is the normal length of time for most of the food to move out of the stomach? It's just a guess. What do you think? 10 to 30 minutes, 1 to 2 hours, 3 to 4 hours, 6 hours? even 12 hours. What are you guys thinking? 1 to 2 hours. I got someone at 6 hours. Good, 3 to 4 hours, 1 to 2 hours. So we kind of have a nice spread going on here. So I will give you the answer. It's 3 to 4 hours. So anyone who got 3 to 4 hours, you are in that nice sweet spot. So anytime it takes longer, and this is on average, remember I said certain fatty foods take longer, proteins take longer than carbs. Carbs are the shortest, but in general, it should take roughly about 4 hours for food to move out of the stomach. If more than 10% of the food that you have ingested is left in your stomach after 4 hours, you are considered to have delayed gastric emptying or delayed stomach movement, okay, which is a telltale sign of this stomach dysfunction. All right. So another aspect, or another root cause, as a naturopathic doctor, we're always trying to figure out root cause, and especially with a condition like this, where it's hard to pinpoint what's going on, understanding root cause is quite important. So inflammation can be another reason why you have stomach distress or upper GI distress. Remember, we talked about as the food moves down the esophagus into the lower part of the stomach, it's going to give some sensory input to the stomach to kind of slow down the emptying, to add more acid, to keep on churning. And then ultimately that food is going to move into the upper part of the small intestine. I told you guys it was called the duodenum. That's where I'm showing right here with my laser pointer. Now, if that food either is moving out too quickly or undigested or with too much acid being produced, that acid can actually expose the small intestine, can be exposed to the small intestine and cause damage, okay? Remember, the small intestine, that upper part, needs to be at a neutral pH to really do what it's supposed to do with these other enzymes being released. That's why you would normally, under normal conditions, have the input of what we call like our baking soda, sodium bicarbonate. So you would have the input of that baking soda from the pancreas, okay? And that would neutralize the acid. But if for whatever reason, the small intestine is sensitive to acid, whether it has to do with the stomach having excess acid production, sometimes it has to do with the presence of those little bugs that I talked to you about, the H. pylori bugs. Sometimes it has to do with a local allergy. They've even found association with people who are allergy type, which means they have other allergic conditions. Maybe they have asthma, or they have, eczema, or other type of allergic conditions. Sometimes it can lead to immune problems or immune activation in the small intestine, and that can lead the small intestine to be very exposed to acid, become hypersensitive. And remember, I told you when acid hits the small intestine, what does it do as a reflex? It slows down the emptying of the stomach. Now, if you have this happening often, what will ultimately happen? The stomach, instead of taking around 4 hours to move the majority of food out, will take on the order of 5 hours or 6 hours or 8 hours. And guess what? By that time, you will have eaten another meal, or you at least would have been hungry perhaps. And now the stomach cannot accommodate as much. Now you're feeling bloated, you're feeling full, and you haven't even completed your meal, okay? All right, so the last concept around root cause that I want to bring to you guys' attention is this idea of dysbiosis. So dysbiosis is just the imbalance of normal to abnormal, or bacteria and bugs that should not be in the GI tract versus those that are normal and that are helpful and beneficial to be in the GI tract. So one of them I told you is H. pylori. H. pylori comes in on the foods that we eat, okay? But if you have a strong stomach function where you're producing sufficient acid, you're not taking all of these acid reducers all the time, then you should actually be able to kill off H. pylori. It shouldn't really affect you, all right? It's natural, again, to fresh foods, to raw foods, but you have to have proper stomach function to eradicate it before it takes hold and does damage. Other things, norovirus is the most common virus that causes, one of the more common viruses that cause a stomach virus. E. coli, you know, if there's food contamination, we know that one to also cause stomach viruses. So this image here is essentially showing you that the majority of bacteria, good or bad, but let's say good in this sense, should be in the large colon. Okay, the large colon is this thing that sort of looks like a question mark. Okay, this is the large colon. You can see me moving around it. The large colon should have the most microbes. Okay, you can see that number there. I don't even know if what is that? This is 1 million. This is like 1 trillion, right? 100 trillion microbes should be in the large intestine. As you move backwards into the small intestine, the end part of the small intestine, you see that number goes down. We're somewhere near 100 million to 100 or to 1 trillion. As you move backwards even further, you're around 10,000. As you move backwards even further towards the end of the stomach, you're around 1,000. And as you get into the stomach, which should be a sterile environment because of the acid, you should have very little bacteria, good or bad, okay? The bad should be eradicated and the good really shouldn't survive there. So I mentioned this for 2 reasons. Bacteria coming into the GI tract, and then on the opposite side, bacteria that can be moved backwards from the other parts of the GI tract. When you have bacteria moving backwards from the large intestine, for instance, we call this SIBO, small intestinal bacterial overgrowth. And that overgrowth creates problems because it actually slows down the entire movement of the digestive tract. So it makes everything slower, dysmotility. All right, so let's put all of this together. All right, you can start with low muscle tone or nervous system dysfunction. And then that can lead you to slow motility in the gut. And that leads you to these digestive symptoms, including things like candida and SIBO. Or you can go even further. You can start with overgrowth in the GI tract. And by the time you make your way backwards, you're back at having a slow moving digestive tract. So it's a vicious cycle. No matter where you start, ultimately, it will impact upper GI health. Now, I put this here just to kind of show you what's being done already in the conventional world, in the pharmaceutical world. For people that have stomach or digestive distress, the first thing we're going to look at is that bacteria we talked about present? And if that bacteria is present, they treat it and they assess response. And a lot of times they get better and some people are non-responsive, okay? But if H. pylori is not the issue, then they will try to give you an acid reducer, give you about 1 month prescription for acid reducer, or tell you to pick some up from the local pharmacy. If you still don't respond, they will look at something that's either an herbal or a prescribed neuromodulator. What is a neuromodulator? Most of them are working on motility. They're helping the body to move things along. And actually, many of them fall into the drug category of antidepressants. And finally, if you still don't respond, then they will try something that really mechanically makes the movement of food more expeditious, okay? So it will move food downward in a more expeditious fashion, okay? So they have also medications that do that. So you can see there's sort of a process, okay, of how you treat this. But as we discussed early on, each time you go around this loop or you're a poor responder, you have to go back to the doctor. You have to get new treatment. You have to do trial and error at your pharmacy. So my question, the question that I'm asking, tonight is there a better way? So I am introducing you guys to this botanical, high potency botanical ginger extract, which tends to, or you can see in these different areas, will answer some of the concerns in how we would treat this type of stomach issue. Also how how ginger works in order to be effective on multiple angles at the same time. So not necessarily going through this loop, determining if you are negative or poor responder again, but something where you are able to address multiple angles at the same time with potentially the same natural product. All right, so there's lots of literature, lots of research. I have the references at the end about how ginger works in the stomach and upper gut. So it enhances movement. It accelerates the emptying of the stomach. So remember, we talked about lots of reasons why the stomach may not be emptying in the time span it should, which is on average 3 to 4 hours. We talked about oxidative stress or free radicals. We talked about diabetes. We talked about getting older and just that whole nervous system being on the slower side. We talked about stress and various things that can also impede the movement. So ginger is a natural motility enhancer, okay? It also stimulates the lower part of the stomach where you're moving into the small intestine to contract and move food into the small intestine so that it doesn't kind of hang at the bottom of the stomach and kind of pouch outward. It's a carminative. A carminative means that it helps us with gaseousness. It minimizes gas production. Gas can make your stomach feel very full. I think all of us may have experienced that at some time or the other, especially if you wait too long to eat. Your stomach fills with gas. So ginger is great for gas. It increases enzyme production and bowel secretion. So even as that meal that you're eating, you want to be able to produce sufficient enzymes. A lot of people take digestive enzymes with their food, but did you know that ginger does this naturally? And it does it in such a way that it's not abusing your body to overproduce these enzymes. It's just making it produce it more in a more natural, consistent way. Ginger also protects the GI tract. So interestingly, aspirin and the use of things like ibuprofen over an extended period of time, I told you guys how it erodes the lining of the stomach and it can cause ulcers and inflammation. Ginger is actually protective. They've done some studies to show that doing ginger in combination with these long-term pain medications and anti-inflammatories can actually protect your stomach. And this is just one of the mechanisms by which it does that. This is also important when it comes to H. pylori as well. Ginger is an anti-inflammatory systemically, not just in the digestive tract. It's an antioxidant systemically, not just in the GI tract. It supports a healthy microbiome. So there's also been some literature about that and how by helping with moving food down and along, that it helps promote good bacteria in the large intestine and making a better balance of that bacteria to bad bacteria. And as I mentioned, it has some specific action against H. pylori showing to be antimicrobial. So I got another question for you guys. Have you ever used ginger in any form, any type of ginger tea, ginger candies, ginger capsules, any form of ginger for digestive distress and found relief ever? No, you haven't, and you don't know anyone who has. You haven't, but you know people who have. C, you have yourself. Or D, you have and you know others who have also. Good. So some people have, and they know people that have. All right, very good. Thanks so much, guys, for sharing. So again, a nice spread. A nice spread. So we're pretty much a diverse group here as far as this is concerned. All right. All right, so some of ginger's mechanisms. So there's two mechanisms. One of them is ginger helps to move things along. Remember I told you that you shouldn't be eating while you're running, between errands in your car and doing things where your brain has to be active. You need to be alert. You need to have good reaction time. All of that requires blood and your nervous system to be active in the periphery of your body, like your arms, your legs. All of those things are what we call the fight or flight, right? So that's part of your nervous system that is going to allow you to be reactive. That's what you trigger when you're under stress. Digestion should happen on the opposite of that. It should happen when you are relaxed, okay? The whole part of the nervous system that's controlling that is called the parasympathetic nervous system. It's involuntary part of the nervous system, and we call it the rest and digest nervous system, okay? So one of the chemicals that help with this rest and digest part of the nervous system is acetylcholine, and ginger has some mimicking effects, meaning it acts like acetylcholine and it helps to move food along. Part of that rest and digest action is helping with peristalsis. It's helping with that movement, that downward propelling of food so that you can digest it, you can absorb it, and you can remove the waste products, okay? So by being a mimicker or being like acetylcholine, ginger is able to move things along and increase stomach emptying and shorten the amount of time for people where it's extended beyond 3-4 hours. It shortens the amount of time that food stays in the stomach. Another mechanism is those pacemaker cells that I talked about. Because ginger is anti-inflammatory, ginger is antioxidant, it's able to reduce some of the damage where there is lots of free radical damage that can cause these nervous system cells, these ICC cells that I talked to you about, to become damaged, okay? So it improves these pacemakers, and these pacemakers are just like the pacemaker that you think about regarding the heart. It keeps the rhythm of the heart going. These GI pacemaker cells keep the rhythm of the digestive tract going so that it's moving in a coordinated fashion, okay? It makes it so that the movement of the stomach and the small intestine is controlled and not spasmodic. When you have spasms, you have pain, okay? So by way of being an antioxidant, by way of being an anti-inflammatory and having this kind of, almost affinity to the digestive tract, ginger is able to improve damaged pacemaker cells. All right, so ginger is composed of lots of components, just like most natural actives. It has polyphenols, which are super important. I'm sure you guys talk and have heard about polyphenols. These are the very potent actives in our plant kingdom. For ginger, these polyphenols include gingerol, shagawol, and even one of the kind of oils, or if you will, like the essential oils of ginger as well, gingerone. So these polyphenols are what allow for the anti-inflammatory, antioxidant effect. They also allow for some of the other mechanisms that we talked about. So professional strength ginger by Hallelujah Diet is a ginger concentrated extract, okay? So it concentrates the actives. Gingeroids are your gingerols and your shagawols, those two potent polyphenols that I mentioned, to 26%. Now, in regular dry ginger powder that you have in your house, that you may use in your culinary dishes, ginger is only around 2%. Those ginger actives are only around 2% in dried products. And in a fresh product, it's even smaller than that, okay? So that means if you're using fresh ginger in your food or making fresh ginger tea, you're getting some, but remember, it's minimal, okay? So here, especially for people who deal with chronic GI, and stomach distress, you're getting a very potent concentration of ginger active. Also, the preparation is important. There's been some research to show when you do different things with ginger actives, meaning if you heat them really high, you actually, when you make ginger candy, you change some of the structure of ginger when it becomes sweet versus when it's pungent, when its solvents are applied to it. All of these different things can make the ginger actives ineffective. So with the HD professional strength ginger, you're getting a concentrated form of the gingeroids. They are stable. They are the active forms that are doing the job that we've been talking about regarding stomach health. It uses a type of extraction method that keeps these gingerol actives potent. And as I mentioned, makes them super stable. It minimizes how they are, minimizes degradation. So they're not degrading over time. And it optimizes so that you can take this, not as a tea. You can't always carry a tea with you, even though it's yummy. But this makes it so it's easy to deliver in a capsule. The professional strength ginger is also backed by a patent. So it's been patented. It's been awarded internationally for innovation that allows for such a high concentration to be delivered in a very low dose. It's been clinically studied. So I'm just gonna kind of close out in the next 2 slides talking about the study. We've talked about all this theoretical aspects of why people have this chronic stomach, upper GI distress and how ginger can be helpful. But we also have clinical studies to show this and prove that it helps people at a very low dosage within 2 weeks time. So we're talking about very short period of time. And there's been all kind of safety data shown that even at this high dose, that it is a very, very, very safe product, okay? So you can rest assured that you're taking something that's good for you, but also that is safe. So the clinical study that was published in the Journal of Dietary Supplements, this was a gold standard design where they studied the ginger active. They had double-blind, placebo-controlled study. They recruited people that had stomach and upper GI distress. With any of the symptoms that we talked about here, they had to have 3 or more symptoms. The age group was quite wide, so from 18 to 55 years old. There were over 50 subjects that were enrolled. The dosage was only 200 milligrams twice per day. That's the active that's in professional strength ginger. And this was a very short study, only 28 days, right? But they had an interim evaluation. So midway in between the study at 14 days, 2 weeks in, they evaluated all of the parameters to see if people had great benefit and if they had any intolerance of the ginger product, right? If they were having any side effects at all. So here are the results just in a nice bar graph to compare. In the brown is the placebo group, and in the yellow is the ginger active group. And then you can see day 14, and this is versus day 28. And then this is also what we call a responder rate, and you can see that the key is the same here. So some of the results that I want to bring to your attention was that at week 2 and also at week 4, there was between a 70 and 80% benefit that was seen or able to be noticed by the subjects taking ginger, all right, taking this ginger active. Whereas in the placebo group, at weeks 2 and 4, there was only 28 or up to 38% people seeing benefit, right? So almost double the people in the ginger active group saw benefit over the people who were not taking any ginger at all. And in response, in terms of being a responder, 80% of people, 79%, 80% of the subjects that took ginger responded to the treatment, which means they got either minimally better or they had some intermediate benefit or they were significantly benefited by taking it. So that spectrum, they had some improvement, whereas only 21% of people in the placebo group at at 4 weeks had improvement. You can see at 2 weeks, the placebo group had no improvement. The responder rate was not even measurable. And finally, what I think is super impactful is the elimination rate, okay? So when it comes to this type of stomach and upper GI distress, I told you guys that obviously there were a number of symptoms that I mentioned could be part of this, but the most common symptoms are fullness after eating, bloating above the belly button, and fullness before the meal is complete. So we looked at how effective was taking ginger at the ability to eliminate those particular symptoms. And this was done at the 4-week mark. And you can see here that 64% of subjects reported being able to completely eliminate those 3 specific symptoms within 4 weeks of taking the ginger active. 64%. And if you go back when you have a chance, and you look at the previous slide when I talked about how we treat this from a conventional sense, you'll see that a lot of the treatments that I mentioned from a pharmaceutical perspective are not very effective. You're getting like 10% effectiveness, 15% effectiveness, not as effective. Now, of course, these are different studies, different study populations, but nonetheless, you're seeing a very significant increase in people who were responsive and having full elimination of the top 3 symptoms of GI and stomach distress, whereas placebo group, not so much. And then you can see here, if you look at all of the symptoms that were assessed, there were statistically significant differences between the placebo and the ginger active group, including things like reducing upper abdominal pain, discomfort. We talked about fullness, we talked about bloating, and we talked about early satiety or being full before the meal is complete, but things like belching and nausea. The only one that was not significant between the 2 groups was vomiting, but that's not a primary symptom of upper GI and stomach distress. It happens in some people, but not most, okay? Even heartburn showed statistically significant benefit. So, last question. Choose the sentence that best describes your knowledge of ginger before listening to today's presentation. Did you only know about ginger nausea benefits before today's presentation? Did you know about all of ginger's different digestive benefits? Is today your first introduction to ginger and stomach health specifically? And before today, did you not know that a natural formula that could address stomach and digestive health even existed? Good. So it looks like we learned a lot today, so that's a good thing. I see lots of people chiming in with that they learned a lot, either not knowing a lot about ginger at all or learning a lot about its different ways that it can impact the digestive tract. So I thank you guys for your time. It's been a pleasure. There's lots and lots of research associated with ginger and GI health, upper GI health in particular. And so I tried to include a lot of those references here if you guys would like to read and review at another time. So thank you so much. Paul, I'll pass it back to you.
Thank you, Dr. Siobhan. It's great information and I think great insights into how the digestive process works. And for many of us, we eat food and it goes through our digestive system, but we don't understand the mechanics of it, even in the slightest form. So that was great information. So, you know, how does the stomach distress function impact bowel movements, constipation, diarrhea? Is there any correlation between those elements?
Definitely, particularly people who have these upper digestive tract concerns, right? The stomach and the upper GI related symptoms. It gives us insight into the fact that there's a motility issue, there's a movement issue. Now, I talked to you guys about why that might be, but the fact is that there's likely a motility issue. Now, the digestive tract really is just one long tube, right? With an entry point and an exit point. I mean, it's convoluted, but it's one tube, and it's one nervous system that is talking to this tube and telling this tube to move. So if we are having symptoms in the upper GI tract now, and you kind of don't do anything about it, you don't address it, you normalize it, you kind of just move through, and eating just becomes a job and not so much, something that you enjoy because you're in pain or discomfort. You're missing out on an opportunity to save yourself some concerns in the lower part of the GI tract. So you can kind of think it hasn't quite impacted the lower GI tract yet. Maybe it has in some people. Maybe they have concomitant symptoms, lower GI tract symptoms and upper GI tract symptoms. But for some people, it could be a preview to what's going on, because it's one tube with one nervous system. If you have motility issues at the top, you will run into motility issues at the bottom in a very likely, period of time in the future. And additionally, the functional dyspepsia, so the real clinical name for this upper GI distress, is pretty much a sister condition to IBS, irritable bowel syndrome, which happens in the lower GI tract. Okay, it's a sister condition. There's oftentimes overlap in a significant portion of the population where they have IBS and they have functional upper GI tract issues as well. So my answer is yes and yes. So it can be an insight to something that may start to rear its ugly head later, so you can try to address it now. And it also can be something that's currently happening concomitantly, where you may have the two of them occurring at the same time, or even someone who may have IBS and has yet to have upper GI problems, but it could be on the horizon. One tube, one nervous system.
And most likely somebody who's got distress in the lower GI tract had been experiencing for a period of time distress in the upper, and that continual dysfunction kind of bred to the problem of the elimination.
That's right. That's right. So I don't see them as separate. I think it's more of a timing thing. Some people may have some greater sensitivity in the lower GI tract or susceptibility. Some may have greater susceptibility or triggering in the upper GI tract. But, the simplest way to think about it is it's one long tube from mouth to anus. So if there's any issue with motility, things like constipation, diarrhea, having alternating of the two, having pain in the lower gut. We talked about what happens when you have dysbiosis. And if you don't have good flow of food, that can backtrack bacteria up into the parts where they should not belong. So all of these things are connected, Paul.
Absolutely. And is it safe to say that if somebody's dealing with a lower GI issue, that by helping to take care of the stomach and the dysfunction there, that it can contribute to helping to heal the lower?
I would definitely say so, mostly because ginger is multifaceted in its use, right? So if you, it's a very potent, it's in the same family as turmeric, which most people know to be a very strong anti-inflammatory, but ginger is not only a strong anti-inflammatory and not only a strong antioxidant, it doesn't have the type of absorption concerns for the most part as turmeric has, and it has an affinity specifically to the GI tract, also to the lungs, but it has a great affinity to the GI tract. So I would say yes, many of the conditions of the GI tract are inflammatory at their root. Oftentimes, they are dealing with some kind of infection. You can see that the ginger products are antimicrobial, particularly when they include the volatile oils or the essential oils of ginger. They have antimicrobial components. So that's why I think it's such a cool active, because that list that I gave you, the uses are multifaceted, or the effects are multifaceted. It's not just it's not just targeting one thing.
Take one capsule a meal before the meal. Is that how you would suggest somebody taking that?
Yes, actually. So I would suggest with the larger meals of the day, so lunch and dinner, and to do it, it's best actually to do it either in the middle of the meal or right after you finish the meal, because it's helping you to produce the acid and produce the enzymes. We generally suggest that you do it in the middle of the meal or right after you're done, because you don't want to kind of prime the digestive tract too much before that food actually hits. We don't want you to have symptoms, by ginger doing its job. We want it to do its job when there's food in the stomach. So just take a break right in between the meal. I often don't recommend drinking a lot while you're eating, but if you take a quick, swallow of a little bit of water with the ginger capsule, or take it right after you're done. So have it right, on your napkin, your plate, and then it would work quite well.
That's great. But appreciate the wonderful information, and I know that the product is fantastic and the results are incredible. So we appreciate you sharing the information. Any last words before we sign off for the night?
I don't think so, except for the fact that we have to preserve our digestive tract. It's so many great philosophers and lots of very intelligent people, physicians throughout time have always said that health starts in the gut. So anything we can do to support that and to see the gut as starting not just in the colon, but even above it, in the stomach and in the upper part of the small intestine. That's where a lot of the work is done to help us absorb and properly digest our food. So we should definitely make it a prime thing that we want to focus on in terms of becoming healthier overall.
Absolutely. Well, thank you so much for sharing with us this evening, and we look forward to having you again at another time.
Very good. Thank you so much, everyone. Have a great evening.
All right. Thank you, everyone. And we pray that you'll stay in health, and we look forward to bringing you another quarter. And yes, this is recorded and it'll be posted here by the end of the week. God bless. Have a good evening.
God bless. Have a great evening.